Hi, my name is Kate, I'm a physiotherapist, and today let's continue the topic of sciatica treatment. Today let's talk about sciatica from foraminal stenosis. I know that you might be already a little bit bored with this topic because this is my third movie about sciatica treatment, but as I already told you, we have no one rehabilitation protocol in sciatica. The exercises we use depend on what caused the irritation of the sciatic nerve, and there are many different causes of sciatica. So today, let's focus on foraminal stenosis. Stay with me. Sciatica caused by stenosis is one of the most challenging and difficult therapeutic case because the degenerative changes that are made simply already exist, and we physiotherapists are not able to remove them. And if someone tells you that with some sort of massages or exercises or adjustments, he or she will cure your spinal stenosis, he or she is lying. We cannot do it. The degeneration of the bone is done. And the only one who can deal with the degenerative changes of the bone is the surgeon. Stenosis is nothing more than a narrowing, and it can concern both the spinal canal itself and the intervertebral foramens. The narrowing is caused by bone tissue growing in inflammatory process, and in the radiological image we see the bone beaks, so-called osteophytes. In the case of sciatica, the most common stenosis is the foraminal stenosis, in which there are osteophytes formed on the edges of the vertebral bodies, reducing the lumen of the foramen and putting pressure on the sciatic nerve. Usually, cases of sciatica from foraminal stenosis are chronic cases. Sciatica appears and disappears and then appears again, and sometimes such patients struggle with sciatica for even years. The picture of the patient with an acute sciatica caused by foraminal stenosis is as follows. The patient will enter the office with a strong forward lean. Why? We need to look at the spine. Here you see in an intervertebral foramen, and here is the nerve which is forming the sciatic nerve. This is a standing position. Look what is happening to this foramen if I lean forward. This foramen is getting bigger, so the nerve has more space, so it is a natural pain-reducing position. Also, usually we will see a side bend towards the opposite direction. So if I'm having sciatica in my left leg, I will have my trunk a side bend towards the right side. Why? The same reason. This is standing position, and if I am just moving my trunk towards the opposite direction, this nerve has more space. So it is also a natural pain-reducing position. Patient with stenosis is often referred to as a shopping cart syndrome because a patient feels less pain when leaning forward. Usually these patients prefer to sit because it relieves the pain rather than to stand or walk, which struggles with the symptoms. In the case of sciatica caused by foraminal stenosis, unfortunately, I do not have a single proven therapeutic method, and I always have to try what works. Of course, my goal is to centralize the symptoms, which is the golden rule in sciatica treatment. If you don't know what a centralization of the symptoms is, please check my video about sciatica from disc herniation, where I discuss this topic. The patient with sciatica caused by foraminal stenosis will be relieved by an unloaded flexion positions, so this one, while the extension positions under the load will provoke more pain. Why? As we already explained, if we flex our lumbar spine, then the space over here for the nerve is bigger. Also, a good trick is to rotate a little bit a pelvis and direct the legs towards the opposite direction, because again the space is bigger. While if we stand, look what is happening with the foramens, they are closing. Therefore, with such patient with foraminal stenosis, I will usually work in lying positions, and now I will show you some exercises that may be helpful. We perform each exercise in 3 sets of 10 repetitions. While lying on the back, perform pelvic tilt. Press the lumbar part of the spine towards the ground. Lying on your back with your legs bent, raise your right leg and then your left leg by flexing the hip. Lying on the back, pull the arms to the knees with the head lifted. You can twist the pelvis and legs in the opposite direction to the pain. In my case, it will be to the right, because this will open the space within the foramen for the sciatic nerve. On all fours, move your pelvis towards the heels, and here I can also turn my torso to the right because I have a sciatica in my left leg. In all fours, perform cat and cow exercise, but without the cow, so only from the middle position to the bending position, and repeat. In patients with stenosis, it is very difficult to assess how long the recovery will take and whether the patient will fully recover at all, because here we are not dealing with the intervertebral disc, herniated disc that can heal, but we are dealing with the permanent degenerative changes over which we have little influence. So all we can do is to increase the mobility of the affected region, increase the mobility of the rest of the spine, increase the mobility of the nerve itself. But as I said before, this type of sciatica is the most difficult to treat by physio. Okay, so that will be all. If you have any comments, leave it in the comment section below, and see you next time. Thanks for watching, and bye.